Well, the Centers for Disease Control and Prevention warned Americans today not to travel to the West African nations of Liberia, Guinea, and Sierra Leone, where hundreds have died in the worst outbreak of Ebola ever. We also learned today that arrangements are being made to bring home 2 American aid workers who contracted the disease in Liberia, Dr. Kent Brantley and hygienist Nancy Wrightbowl. We have 2 reports tonight. First, Dr. Jon LaPook.
The 2 Americans hospitalized in Liberia with Ebola last weekend are reported to be in worse condition. The charity groups they work with say Wrightbowl is now taking an experimental serum. There was only enough for 1 patient, and Dr. Brantley asked that it be given to Wrightbowl. Instead of the serum, the doctor received a blood transfusion from a boy he treated who recovered from Ebola. The hope is the blood contains some protective factor. Last night, during a prayer service in Charlotte, North Carolina, Wrightbowl's husband, David, who is in the hospital with his wife, called to thank the crowd of well-wishers.
I want to be a bit cautious, but she's sitting up and she was talking with us and she's able to move about. She's drinking lots of fluids, which is good for her. That's her main job these days.
The CDC alert is directed at U.S. residents with non-essential travel to the 3 countries battling the outbreak. There are 20 quarantine stations at airports and other points of entry, staffed with health officers responsible for deciding if a sick person can enter the country. Infectious disease experts believe the U.S. has the resources to control the spread of the virus should it come here. Dr. Stephen Monroe is with the CDC.
So we're fairly comfortable that if a patient were identified here in the U.S., that the normal kinds of barrier nursing precautions that would be in place would prevent spread even before the person was confirmed to be a case of Ebola.
Late today, Emory University announced it is preparing for an American aid worker who contracted Ebola in Africa to arrive in its special containment unit in the coming days.
So, John, that truly has the potential to cause real concern here by people in America. Give us some perspective on that.
Well, JB, any kind of a transfer like that is going to be done with a strict protocol and with the patient very carefully isolated. So I don't think people need to worry about getting the virus during that transfer. But in general, I know people are concerned about catching Ebola, and they should be reassured by the fact that you need to have direct contact with body fluids. So it's not spread through the air. If somebody coughs and they happen to be down the row in an airplane, you're not going to get it that way. And the other thing that's reassuring is that unlike flu, where the person can be contagious and infectious a day before getting symptoms, with Ebola, you have to be symptomatic in order to be contagious.
Dr. Jon LaPook, thank you so much. Today, the World Health Organization said the Ebola death toll in Liberia, Guinea, Sierra Leone, and Nigeria has hit 729. Debora Patta is in Johannesburg tonight. And Deborah, it appears that part of the problem is the fear and misinformation surrounding Ebola.
We're talking about a region, James, that has been ravaged by brutal conflicts in the past. Yet Ebola is even more terrifying than war. Many patients won't go for treatment and refuse to go into isolation wards, believing that is where people go to die. In some instances, families have broken into treatment centers to free their relative. There have been reports of health workers being attacked, accused of bringing Ebola into the country rather than trying to treat it. And of course, it doesn't help that aid workers often wear full protective gear, which only adds to the fear.
And Deborah, so what are the governments of these countries doing?
In Sierra Leone, security forces are going door to door looking for infected people and encouraging them to go for treatment. In Liberia, Ebola survivors are doing much the same thing, trying to get the message across that going into an isolation ward is not a death sentence. Both countries have declared public health emergencies. Some schools are closed. There are also some border crossings closed. These, James, are countries in virtual lockdown.
Debora Patta in Johannesburg. Deborah, thank you very much.